bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? For what purpose does Mr. Bilirakis?
Strike the last word.
Gentleman's recognized for 5 minutes.
Thank you. I urge my colleagues here to support my bill, H.R. 7189, the Congenital Heart Futures Reauthorization Act. This legislation will reauthorize the National Congenital Heart Disease Research, Surveillance, and Awareness Program at HHS for the next 5 years. We've made great progress over the years in congenital heart disease research and care, and I'm proud to have been involved in the creation of this program and its reauthorization efforts previously. We've heard from stakeholders that the needs for this patient community have been evolving as the number of adults living with CHD in the United States has been steadily increasing, thank goodness, with estimates suggesting approximately 2 million currently affected and a projected annual growth rate of 5%. We also know that there is a critical transition point as patients grow from pediatric to adult care, requiring specialized medical attention and coordination to ensure continuity of care. Too often, due to workforce challenges and education gaps, patients with CHD face significant barriers in access to care. That's why I'm glad the subcommittee, in the subcommittee, we were able to include language that requires HHS to issue a comprehensive assessment regarding the acute needs of congenital heart patients nationwide, examine research gaps, and evaluate and provide recommendations on how to improve the workforce and strengthen training for providers to help reduce these barriers. HHS will be required to consult on long-term strategies with stakeholders in the patient and provider community. So we can learn how best to address shortages, increase awareness, and offer best practices. We'll be bringing together the relevant researchers and agencies such as CDC, HRSA, and NIH together to examine these needs and foster collaboration. That's the key as far as I'm concerned, collaboration. Together, we can improve long-term health outcomes and quality of life for congenital heart for the community, and I believe H.R. 7189 will take a significant step towards improving our continued efforts to research and care for patients with CHD. I want to thank my fellow leads on this legislation, a bipartisan effort, Representative Soto, Carter, Schiff, Salazar, and Cardenas for their support on this initiative, as well as Senators Durbin, Young, in the Senate. And I hope we can quickly move passage on the House floor. I want to thank the chairman for agendaing the bill today, and thank you for bringing it up. And let's pass it out and get it to the floor as soon as possible. Thank you, and I yield back.